The burn scars running up her forearms caught Dr. Mercer's eye on a Tuesday night in late September, and that single observation crystallized everything he already resented about Margaret Walsh. He stood at the nurses' station of St. Michael's cardiac wing in Savannah, watching her through the glass partition of room for 12, her cardigan sleeves rolled to the elbows as she adjusted the 4-line on an elderly patient recovering from atrial fibrillation. The scarring was old, puckered tissue that mapped a geography of fire and survival across both arms. He tapped his pen against the chart in front of him, the metallic click hollow in the fluorescent-lit silence. She represented everything wrong with modern nursing: competence that didn't require his validation, respect from patients who smiled when she entered their rooms, a quiet authority he could neither control nor diminish. The pen clicked again. Harder. Margaret Walsh had worked the night shift at St. Michael's for exactly 6 months and 3 days. She moved through the cardiac wing with the kind of efficient silence that made no demands, asked for nothing, and somehow made every other nurse seem louder, messier, less essential by comparison. Her hands were steady on the 4-line, 14-gauge angiocath, standard push, the needle sliding home without hesitation. The patient, a retired accountant named Harold Chen, exhaled with relief. "That's the best anyone's gotten it on the first try," he said, his voice soft with gratitude. Margaret checked the infusion rate, made a notation on his chart, and replied with professional warmth that somehow never crossed into familiarity. "You're doing great, Mr. Chen. Press the call button if you need anything." She was already moving to the next room. Always moving. Always necessary. Never asking for credit. In the break room on the 4th floor, Margaret opened her locker at 2:43 a.m. Inside, on the middle shelf, sat a folded American flag in a mahogany wooden case, the corners creased with military precision. Clipped to the frame with a metal clasp was a photograph, a young man in full combat gear, face half obscured by the brim of a helmet, but his eyes visible and alive and forever 26 years old. Corporal Margaret Davidson. 8 years in her locker. 8 years of press the call button if you need anything, 8 years of moving through fluorescent corridors like a ghost, 8 years since her RPG round in Ramadi turned the world sideways and left her holding his folded flag while the mortuary officer spoke words that meant nothing. She touched the wooden case, her fingers lingering for exactly 3 seconds. The break room hummed with the sound of the vending machine cooling cycle, a rhythmic electronic pulse like distant machinery. Then she closed the locker, locked it, and returned to work. What happened next didn't just happen. It accumulated. Dr. Mercer began his observations with the precision of someone cataloguing evidence. Margaret assisted on an emergency appendectomy in OR 03 on a Friday afternoon, and he positioned himself at the observation window, arms crossed, waiting for some indication of the incompetence he was certain existed beneath her composed exterior. The surgical team was 4 people, Dr. Samuels conducting the procedure, Margaret assisting, a surgical tech managing instruments, an anesthesiologist monitoring vitals. The surgery proceeded without complication, but what Dr. Mercer noticed was Margaret's hands during the closing phase. She was preparing to tie off the arterial bleeder using a technique called 3-point pressure, a method of suturing and vessel compression that required knowledge of vascular anatomy most nurses never acquired. It was taught only to Special Forces field surgeons in forward operating bases. Her hands moved with the muscle memory of someone who had performed the technique dozens of times, in conditions far worse than a sterile operating room with a full surgical team. The 3-point pressure technique. A civilian nurse doesn't learn that from YouTube. Dr. Mercer's jaw clenched. He recognized competence when he saw it. He was, after all, an excellent surgeon himself, which was precisely why he understood that Margaret Walsh possessed a level of medical knowledge that should not exist in a floor nurse with no advanced degree, no residency, no pedigree from Johns Hopkins or Duke or the Ivy League institutions that produced people like him. Her presence at St. Michael's didn't make sense, and what didn't make sense troubled him far more than what he could easily dismiss. He watched her hands move, steady, confident, precise, and felt something shift in his chest that was almost like fear, though he would never have admitted such a thing. An Army sergeant named Clay Halloway was completing his nursing degree through a bridge program at the local community college, doing clinical rotations at St. Michael's on a Tuesday morning. He was a decade younger than Margaret, with the kind of hypervigilance that combat deployments install in people who survive them, and he'd completed 2 tours in Kandahar before a mortar round ended that chapter of his life by way of a compound fracture in his left femur and a medical discharge rated at 40% disability. He was in OR 2 assisting with a routine emergency appendectomy when Margaret came in to support the surgical team. Holloway had seen plenty of nurses. He'd seen excellent nurses. He'd never seen a nurse tie off a vascular bleeder using the 3-point pressure technique while standing in a civilian operating room under fluorescent lights with a full sterile team around her. His hands froze mid-suture. His eyes found hers across the operative field, and for one moment, just one, Margaret's gaze met his, and Holloway understood what he was looking at. "Where the hell did you learn to tie off like that?" Holloway whispered, his voice barely audible over the ventilator's rhythmic wheeze and the soft beep of the cardiac monitor registering normal sinus rhythm. Margaret didn't turn her head. She simply adjusted the retractor with her left hand and replied in the same low voice, the kind of voice that never traveled beyond the surgical team. "Good observation." That was all. No explanation. No denial. No story about a special trauma course or an advanced certification. Just an acknowledgement that hung in the antiseptic air between them like a challenge flag planted on contested ground. Holloway turned back to his suturing, but his mind was now cataloguing every detail it had tried to ignore, the way she moved, the precision in her technique, the absence of hesitation, the way her scarred forearms showed muscle definition that didn't come from pushing hospital beds and turning patients. Dr. Mercer didn't witness this exchange, but he heard about it within 6 hours. Holloway mentioned it to one of the resident physicians as an offhand observation, just asking a question about Margaret's technical skill, and that conversation traveled through the hospital's informal network the way all conversations do, until it reached the attending physician's morning briefing on Wednesday. By then it had transformed into something more pointed, more questioning. The night shift nurse knows field surgery technique, someone mentioned, and Dr. Mercer looked up from his coffee. The room wasn't large enough to contain what he felt in that moment. A floor nurse. A woman with burn scars and a cardigan that covered whatever she was trying to hide. A woman who moved through his hospital like she belonged there, like she belonged anywhere, and somehow possessed knowledge that should have required years of specialized military training. It wasn't possible. Unless it was. Unless she was exactly what she appeared to be, a threat to every hierarchy he'd built his entire career defending. The pen was in his hand again. Click. 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 His rhythm was deliberate now, intentional, the sound of someone making a decision. Margaret was in room 408, checking the 4 line on a post-op patient, her movements economical and sure. Through the glass partition, Dr. Mercer watched her work. She didn't know he was watching. She never seemed to know when anyone was watching, which was somehow worse than if she'd acknowledged the scrutiny with some sign of defensiveness or concern. She simply continued her work, checking vitals, making notations, offering quiet reassurance to the patient as if she had nothing to hide and nothing to prove to anyone. The pen clicked one final time, and Dr. Mercer set it down on his chart with deliberate precision. She represents everything wrong with modern nursing, he thought. And I'm going to prove it. But that wasn't the worst part. The worst part was that Margaret Walsh already knew he was watching. She'd known from the moment his eyes first landed on her burn scars, from the exact second he'd begun calculating what her competence might cost him. Some people carry recognition the way desert animals sense water miles away. She'd spent enough years in places where being unaware meant being dead, and those instincts didn't simply turn off when you worked a night shift in Savannah. They just went quiet. They waited. And as she finished her rounds at 3:17 a.m. and returned to the break room to unlock her locker and touch the wooden case holding Corporal Davidson's folded flag, Margaret Walsh already knew exactly what Dr. Mercer was going to do, because she'd seen that particular species of resentment before. She'd seen it in officers who couldn't understand how their subordinates could be both deferential and dangerous. She'd seen it in people who mistook education for knowledge, rank for competence, credentials for capability. And she knew, with the kind of certainty that only experience provides, that his first moves would be social, subtle, deniable, the kind of cuts that bleed slowly and leave no obvious wound. She closed the locker. The sound echoed in the empty break room like a closing door. Dr. Mercer found Dr. Patel in the physician's lounge on Tuesday morning, timing it precisely when she'd have exactly 6 minutes before rounds. He poured coffee with the careful deliberation of someone about to make a confession. "I wanted to talk to you about Margaret Walsh," he said, his voice carrying the practiced concern of a man who'd weaponized empathy. "I've been reviewing her charting from last week's shift. Tuesday, the one where she assisted on the Hernandez case. She mixed the post-op medication sequence. Didn't document it until hours later." Dr. Patel's hand paused halfway to her lips. "Margaret? She's been flawless on my cases." "That's the troubling part," Mercer said, shaking his head with manufactured sadness. "She hides it well. But if you look at the timestamps..." He didn't finish the sentence. He didn't need to. The implication hung in the air like an infection waiting to spread. By Wednesday afternoon, 3 attending physicians wouldn't make eye contact with Margaret in the hallway. By Thursday, they were requesting different scrub nurses for their procedures. The whisper campaign moved through St. Michael's like a virus, each doctor adding their own interpretation of Mercer's fabrication until the story had taken on a life of its own. Competence without the pedigree was always suspicious. Respect from patients without his approval was always dangerous. Mercer understood that destroying someone's credibility required no explosions, just the careful placement of doubts in the right ears. Then came Unit Director Carolyn's office. Mercer knocked on Friday morning, carrying a folder that contained nothing but blank pages. "I need to discuss staffing concerns," he said, settling into the chair across from her desk like he'd been summoned. "It's about Margaret Walsh. I'm not saying anything definitive, but we should be asking questions about her background. Those scars on her forearms, I looked it up, and trauma like that doesn't usually come from civilian work. Do we really know where she worked before joining us? What kind of establishment was it? I'm just saying, we have standards at St. Michael's, and her questionable background warrants deeper scrutiny before we assign her to high acuity cases." He let the implications float unspoken: danger, instability, liability. Carolyn's pen hovered over her notepad. "I'll look into her personnel file," she said slowly. The humiliation came in room for 47 on Friday afternoon, performed with the precision of a surgeon who understood exactly where to cut. Margaret was checking Mrs. Patterson's post-operative incision, her gloved hand steady and gentle as she assessed the surgical site. The patient's daughter sat nearby, her son-in-law beside her, both watching the nurse with the grateful intensity of family members trusting her with someone they loved. Margaret spoke softly. "The incision is healing beautifully. No signs of infection. Dr. Mercer should be very pleased with how well you're recovering, Mrs. Patterson." The door opened. Dr. Mercer entered with a chart in his hand, moving with the theatrical precision of an actor who'd rehearsed this moment. The fluorescent lights hummed overhead, indifferent to what was about to happen. "Nurse Walsh," he said, his voice loud enough to carry down the hallway. "Could you explain why you failed to document the patient's 0600 vitals?" Margaret's hands continued their work. Her voice came out level and professional. "I documented them at 0603, doctor. It's on page 3 of the chart." She didn't look at him. She didn't stop checking the incision. Mercer flipped the chart with deliberate slowness, making a show of searching for something he already knew wouldn't be there. "This kind of sloppiness is exactly what I've been telling the board about," he said, his voice carrying the weight of a man delivering a diagnosis. "Scar tissue here thinks experience replaces proper procedure. Charting deficiencies in post-op vitals could have serious consequences." Mrs. Patterson's daughter gasped. Her son-in-law's jaw tightened. Margaret's hands remained steady on the surgical site, steady as a laser, precise as an instrument. Her face was a professional mask, the kind of composure that comes from having already survived worse than humiliation. She didn't flinch. Didn't blink. Didn't flush red or retreat into anger. She simply finished her assessment and turned to face him, her eyes meeting his with an emptiness that made him pause for just a fraction of a second, the briefest moment where he wondered if he'd seen something move in those eyes that looked like recognition. "I'll double-check my entries, Doctor," she said quietly. Mercer nodded, satisfied that the performance had landed. He left the room. In his wake, he'd left something broken, or at least, that's what he believed. That afternoon, Margaret stood at the unit bulletin board where Dr. Mercer had posted a formal disciplinary write-up printed on official letterhead, Nurse M. Walsh, charting deficiency, final warning. She stared at it for 3 seconds. No longer. Then she walked to the break room. The room went dead silent when she entered. 2 nurses who'd been laughing about weekend plans grabbed their bags in unison. A third followed, muttering something about needing to return a phone call. Margaret set her lunch on the table, a sandwich from home, wrapped in foil, the kind of meal you pack when you're not sure anyone will eat with you. She sat alone, staring at nothing, her jaw muscles the only part of her that moved. Around her, the break room felt cavernous. A television played in the corner, sound off. The refrigerator hummed. Outside, Savannah heat pressed against the windows like a living thing. The next shift, Margaret was stocking the medication cart when Mercer walked past with a young intern trailing behind him. His voice dropped to a stage whisper, the kind designed to be overheard. "That's scar tissue. Careful what you learn from her. Bad habits have a way of spreading." The intern's eyes widened with the kind of uncertainty that marks the beginning of a lost reputation. Margaret's hand paused on the medication drawer for exactly half a heartbeat. Her fingers registered the texture of the plastic, the small resistance as she pulled it open. Then she continued, methodical, professional, untouched. Her face remained a mask. But 60 seconds later, in the supply closet 3 doors down, she pressed her forehead against the cool metal shelving and exhaled once, slowly. The shells pressed back against her like a restraint. What Dr. Mercer didn't know was that Margaret's composure wasn't breaking, it was consolidating. Every insult was being catalogued. Every fabrication was being filed. Every moment of his arrogance was being documented in the kind of memory that combat veterans develop, where pain becomes data and humiliation becomes intelligence. The trembling wasn't fear. It was restraint. But that wasn't the worst part. On Saturday morning, during an emergency appendectomy in OR 3, Margaret assisted as the surgical team fought to control bleeding in a perforated appendix. The patient's blood pressure was dropping, 120/82, then 115/78, the numbers sliding downward like a countdown. Dr. Davidson, the attending surgeon, was struggling with the hemorrhage. His movements had begun to show the small tremors of a man losing control. The room temperature felt like it was climbing. Margaret moved without hesitation, her hands finding the exact pressure points, applying a 3-point tie-off technique with the kind of muscle memory that only comes from doing something dozens of times under circumstances no civilian could imagine. The bleeding stopped. The pressure stabilized. 108/65 and holding. But someone noticed. Sergeant Marcus Chen, a grizzled combat medic doing his nursing degree, had been watching from across the surgical field. He froze mid-suture. His eyes locked onto Margaret's hands. The technique she'd just executed was impossible for a civilian nurse. That move, the specific angle, the pressure sequencing, the way she'd anticipated the arterial response, that was Special Forces field surgery. That was taught in combat zones. That was remedy. After the surgery, Chen cornered her in the scrub room. His voice was quiet, the kind of quiet that came from knowing things he shouldn't. "Where the hell did you learn to tie off like that?" Margaret's eyes met his for one long moment. The fluorescent light hummed above them. Her hands were steady as she dried them on the paper towel. "Trauma rotation. Long time ago." Chen's jaw clenched. "I did 2 tours as an 18 Delta medic. Only saw that move once, in Fallujah. Combat Support Hospital. Someone showed me real fast because the alternative was watching a Marine die from a severed femoral." Margaret didn't respond. She turned toward the door. Chen's voice followed her. "Who are you?" She walked past him without answering. The door swung shut behind her. In the hallway, her pace didn't change. Her breathing remained controlled. But her hand, the one holding her mask, trembled slightly as she pulled it down. That night, Margaret sat in her car in the hospital parking lot, the engine off, the Savannah heat pressing through the windows. On her burner phone, a secure message had arrived. The 4-star general was being transferred to St. Michael's cardiac unit tomorrow. The man she'd been monitoring for 14 months. The reason she'd taken this identity, worked these shifts, absorbed these humiliations without breaking. The target of her operation, the one piece of the intelligence puzzle that JSOC needed her to confirm before the entire foreign intelligence network operating through the Veteran Care Wing could be dismantled. 72 hours. She had 72 hours to maintain her cover as a nurse named Margaret Walsh, a woman everyone was beginning to suspect was unreliable, unstable, dangerous. The same cover that was starting to collapse under the weight of Dr. Mercer's methodical campaign. The same identity that an army medic had just recognized as something else entirely. In the darkness of her car, Margaret pulled out a folded flag she kept hidden in the glove compartment, Corporal Davidson's flag, the one she'd carried in her locker for 8 years since Ramadi. She didn't unfold it. She just held it, feeling the weight of it in her hands, remembering what it meant to be the kind of person who doesn't break, no matter what breaks around her. Outside, the hospital lights reflected off the windshield like 1,000 eyes watching. And somewhere inside those walls, a man named Dr. Mercer was practicing how to destroy her, not knowing that she'd already survived worse. That she was already something else. That the quiet nurse he was humiliating had held dying soldiers in her arms and refused to let them go. The general arrived at St. Michael's on a Tuesday at 2:06 p.m., his unmarked sedan pulling into the loading dock instead of the main entrance. No security detail. No press. No fanfare. Just an elderly veteran in a charcoal suit, chest pain radiating down his left arm, asking for the quietest room on the cardiac wing and requesting continuity of care from the night shift nurse he'd somehow already met. Margaret's hands didn't shake when she saw him walk into room 512. 14 months. 134 days of night shifts, falsified personnel records, and a fabricated nursing degree from a community college in Quantico, all of it compressed into this single moment. She'd memorized his security protocols, his pattern of movement, the exact timeline of when the foreign intelligence asset would attempt the handoff. She knew his daughter lived in Charleston. She knew he took his coffee black and his oatmeal without brown sugar. She knew him the way only a shadow knows its source. "Captain," he said quietly, the rank landing between them like a live wire. She didn't flinch. She moved to his side with the exact same measured efficiency she'd shown every other patient for the past 6 months, checking his blood pressure, noting the slight wheeze in his breathing, observing how his left hand rested against his ribs. 128/87. Slightly elevated. Perfectly consistent with acute coronary syndrome. She hung the 4-bag of normal saline with the precision of a surgeon positioning a retractor, her movements a language only he could read. "How long has the pain been present, sir?" "Since 1400 hours. Onset was sudden. Left shoulder, radiating through the sternum." His voice carried the clipped precision of someone who'd spent 40 years giving and receiving medical briefs. No shortness of breath initially. Started about 30 minutes ago. Margaret recorded his vitals on the chart with her usual meticulous handwriting, the same script she'd cultivated to seem deliberately unremarkable. But her mind was already running the parallel tracking operation, the intelligence he carried, the asset that would try to extract it. The narrow window before her operational oversight was officially terminated. Tomorrow morning, her reassignment from this room would be final. The director had already made the calls. The paperwork was being processed. This was her last night as the general's primary caregiver, and it was the only night that mattered. Dr. Mercer arrived on the cardiac wing at 3:15 p.m., his expensive leather shoes clicking against the linoleum like a predator's claws on stone. Margaret felt his presence the way prey animals sense a change in air pressure, a disturbance in the electromagnetic field of the hospital. He moved directly to room 512, his face arranging itself into the expression of a physician about to deliver bad news, when in reality he was about to deliver something far more calculated. He nodded to Margaret, a gesture so minimal it barely qualified as acknowledgement, and entered the general's room without knocking. She could hear the murmur of conversation through the door. Mercer's voice had taken on its full charm mode, the smooth cadence he reserved for VIP patients and hospital board members. The general's responses were clipped and formal. Margaret continued her rounds with the methodical discipline of someone who understood that her only advantage lay in visibility without prominence, the art of being utterly unremarkable in the presence of people actively looking for a reason to discard her. At 4:38 p.m., Carolyn from the unit director's office appeared at the nursing station with a manila folder and a sympathetic expression that had the exact dimensions of a guillotine blade. "Margaret, can I talk to you for a minute?" The question wasn't really a question. Margaret followed her to the small office adjacent to the break room, where the air smelled like burnt coffee and the accumulated stress of 1,000 small crises. "Dr. Mercer has raised some concerns about your assignment to room 512. Given your background and the sensitive nature of this patient, he's recommended a rotation change. I'm moving you to the pediatric overflow unit effective immediately." Margaret's composure held like reinforced concrete. Not a tremor. Not a flicker in her eyes. When she spoke, her voice remained level, the voice of someone discussing a routine shift change, not the potential unraveling of 14 months of classified intelligence work. The patient requested continuity of care. Moving me now could compromise his comfort and recovery trajectory. This isn't a discussion, Walsh. Carolyn wasn't cruel, just exhausted and operating under pressure from above. Dr. Mercer has documented performance concerns. I don't have a choice here. Margaret understood institutional power the way a chess grandmaster understands the board. Mercer had made his moves with precision, the calls to risk management, the whispers to the board, the carefully constructed narrative of her incompetence. It was textbook sabotage, strategic, efficient, and nearly impossible to counter without exposing herself. If she fought the reassignment, it would trigger investigations. If she accepted it, her mission failed. She chose a third option. That evening, Margaret sat in her car in the parking garage on level 4, engine off, hands resting on the steering wheel. The folded flag lay in the passenger seat beside Corporal Davidson's photograph, 8 years old now, edges worn from being touched too many times. Davidson had been 19 when the MRAP hit the IED in Ramadi, the same IED that had burned her forearms and taught her that pain was information and scars were just data waiting to be read. The flag weighed nothing. It weighed everything. She made a decision that would change the trajectory of the next 48 hours. At 10:56 p.m., Margaret clocked back in for the night shift, her name mysteriously absent from the pediatric overflow roster. The night supervisor, a tired woman named Elena who'd been working cardiac for 17 years, barely glanced up from her paperwork. Continuity of care issues. A scheduling error that had already been flagged. Margaret would cover room 512 until 6 a.m., and no one questioned it with enough force to block her. Institutional inertia. The tendency of systems to continue along their current trajectory unless acted upon by external force. She entered room 512 at 11:13 p.m. with fresh vitals equipment and a calm that had been earned through a dozen field surgeries in Ramadi, through holding a combat medic's hand as he died from an infection that antibiotics couldn't touch, through the discipline of becoming someone else so completely that your old self became a ghost. The general was asleep, his breathing steady. O2 sat at 98%. Heart rate steady at 62 BPM. She documented his vitals in the chart and positioned herself in the chair beside his bed, the chair designed for families who couldn't bear to leave, for people who understood that presence itself was a form of treatment. At 2:34 a.m., his monitor alarm exploded into the silence like shattered glass. The rhythm shifted instantly, sinus rhythm collapsing into ventricular fibrillation, his heart seizing like a fist with nowhere to go. The general's eyes opened wide, his body arching against the bed as if he could escape through sheer will. Margaret was moving before conscious thought could catch up. She'd seen this before. She'd lived this before. Her hands moved with the muscle memory of a dozen field surgeries, every decision already made, every variable calculated. She reached for the crash cart, her movements a choreography of pure efficiency. The defibrillator pads went on his chest at 2:35 a.m. She charged the system. Everyone clear. The shock sent his body rigid. Nothing. The monitor still showed chaotic electricity with nowhere to go. She didn't hesitate. She grabbed the trauma shears from the crash cart, the same shears she carried in her locker every day, the ones with her call sign etched into the handle in letters so small only she could see them. She'd become a nurse so thoroughly that people forgot she'd been something else. She cut through his hospital gown, through the electrode pads, creating access. The scalpel from the crash tray was already in her hand when she made the incision, left anterior lateral thoracotomy, fourth intercostal space, the anatomy burned into her muscle memory like scar tissue. The ribs separated under her practiced fingers. She could see his heart now, the ventricles in chaos, electricity firing without coordination. Margaret placed her hand directly on his heart. Warm. Wet. Real. She began massage, her fingers finding the rhythm of compression, the dance between force and precision that separated competent field surgeons from the ones whose patients lived. Compression. Release. Compression. Release. The rhythm of keeping death negotiable for just a few more seconds. Come on, she whispered. Not a prayer. A command. 60 compressions. Breath. 80 compressions. Another breath. The oxygen saturation climbed, 68 to 72 to 76%. The monitor showed brief returns to organized rhythm, the heart beginning to remember how to beat without the electrodes telling it. At 2:41 a.m., the rhythm stuttered. Then it caught. The ventricles synchronized. The monitor showed a pattern that meant blood was moving again. His blood pressure registered faintly on the cuff, 52 systolic, barely perfusing the brain, but perfusing. Not dead. Not permanent. The code team arrived 90 seconds later, flooding the room with the precision of a choreography they'd practiced 1,000 times. Margaret stepped back, still wearing the blood of a 4-star general on her hands, on her scrubs, on the edges of her carefully constructed anonymity. Dr. Mercer arrived 90 seconds after the code team did, his badge clacking against his chest as he rushed through the double doors. He stopped dead in the trauma bay doorway. The general's chest was open. Actually open, a jagged thoracotomy wound still bleeding onto the white sheets, Margaret's hands covered in gore up to her wrists, her composure cracking only in the brutal precision of her movements as she stepped back from the stretcher. Her voice was flat, clinical, the voice of someone reporting weather, massive PE. No pulse for approximately 2 minutes. Manual cardiac massage successful. Sinus rhythm restored at 0216 hours. Dr. Mercer's face went white. Not pale. White. The color of a man watching his entire world reorganize in front of him. His mouth opened. Closed. Opened again. What the hell did you just do? His voice climbed an octave. You performed a surgical procedure? On a patient? Are you insane? You're a nurse. A nurse. Do you understand what you've just done? That's grotesque. That's criminal malpractice. Margaret was already stripping off her gloves, the latex snapping like gunshots in the suddenly quiet trauma bay. He had no pulse. 30 seconds until brain death. I did what was necessary. Necessary? You cracked open a 4-star general's chest with your bare hands. Security. I want security here now. This woman is a liability. This is, Dr. Mercer's hands were shaking. Not with concern. With fury. With a recognition that something had just happened that he didn't control, didn't understand, and couldn't spin into a narrative that favored him. The code team was already moving the stretcher toward the OR, their movements efficient, focused, not meeting Dr. Mercer's eyes. Margaret turned toward the sink. She washed her hands under water so hot it steamed, the blood swirling down the drain in hypnotic spirals. In the mirror, she could see Dr. Mercer's reflection, his phone already in his hand, his jaw working as if he were constructing words, building a narrative, planning his response with the meticulous precision of a man who had spent 23 years perfecting the art of institutional warfare. Within 48 hours, Margaret received a certified letter. The state nursing board had received a formal complaint, practicing beyond her scope of practice, performing surgical intervention without licensure, endangering a patient's life through reckless intervention. Dr. Mercer had been thorough. He documented everything, or rather, documented his version of everything. Medication errors from 6 months ago that had never happened. Questionable judgment calls from her first weeks at St. Michael's. A pattern of insubordination and boundary violation. By day 2, he'd made 3 phone calls to board members he'd cultivated over years of golf outings and hospital fundraisers. By day 3, her security access had been revoked. By day 4, she'd received the termination notice. The meeting happened in a conference room on the 3rd floor. 7 people sat around a mahogany table. The hospital director looked embarrassed. The chief of staff looked angry. Dr. Mercer looked satisfied. Margaret sat in a single chair facing them, her hands folded in her lap, her face a mask of professional neutrality that would have impressed a diplomat. Ms. Walsh, the director began, not meeting her eyes, "We've conducted a preliminary investigation into the incident in the cardiac unit. While we appreciate your instinct to help, what you performed was a surgical intervention beyond your scope of practice. The state nursing board has filed formal charges. Pending their investigation, your employment is terminated effective immediately. Your security access has been revoked. You'll need to return your badge and ID before you leave the building today." Margaret's jaw tightened imperceptibly. She had been expecting this. 14 months of deep cover, and the operation was supposed to conclude in 72 hours. The general was supposed to remain stable until the intelligence handoff was complete. But the pulmonary embolism didn't follow operational timelines. It didn't care about mission parameters or classified objectives. It had simply happened, and she had responded the only way a combat surgeon responds to a dying patient. She'd saved him. Which meant she'd blown her cover. Exposed her training. And there was nothing she could do about it except sit in this room and accept the consequences with the same composure she'd learned in 18 months of JSOC training. "I understand," she said quietly. "Do you understand the seriousness of what you've done?" The chief of staff leaned forward. "You could face criminal charges. The patient's family could sue. You've put this hospital in an incredibly difficult legal position. If you had any sense of professional responsibility—" "I understand," Margaret repeated. Her voice hadn't changed. Her hands hadn't moved. Dr. Mercer was watching her with an expression somewhere between triumph and hunger. He'd won. She was being removed. The chaos she represented was being contained, catalogued, and filed away as a personnel problem solved. She had no idea that in exactly 72 hours, everything he believed about victory would incinerate. 3 days later, Margaret stood at a bus stop on Victory Drive, rain hammering down in sheets so thick she could barely see across the street. The October downpour had that smell of Georgia heat colliding with cool air, ozone and wet asphalt, and the faint copper taste of a storm rolling in from the coast. Her cardboard box was balanced on her hip. Inside it was everything 8 months of careful curation had created, a coffee mug with "World's Okayest Nurse" printed on it in fading gold letters. A small succulent in a ceramic pot, its edges brown and curling from neglect because she'd been working 16-hour shifts and couldn't remember if it needed water or darkness or just the basic human attention she'd never had time to give it. And the photograph. Corporal James Davidson. 23 years old. From Tallahassee. Had a daughter he'd never met. The photo showed him in dress uniform, his dress blues pristine, his cover positioned at exactly the right angle, his expression showing the kind of confidence that comes from knowing you're about to deploy into Ramadi and that everyone around you would take a bullet for you because you'd take one first. She had carried the folded flag that had draped his casket in her locker every single day of the past 8 years. She'd never let it touch the bottom. Never let anything rest on top of it. Kept it in the corner of her locker where she could see it when she opened the door before every shift, a talisman and an indictment and a promise all at once. The rain was so heavy now that it felt like standing under a waterfall. Her civilian clothes were soaked through. The box was getting damp. The succulent didn't care anymore. The mug probably thought this was funny. World's okayest nurse, fired for saving a life. There was a joke in there somewhere, the kind of dark humor that survives in the spaces between heroism and catastrophe. Margaret couldn't tell them the truth. Couldn't walk into that conference room and say, that general isn't just a patient. He's the target of my JSOC operation. I've been here for 14 months monitoring a foreign intelligence cell that's been using St. Michael's Veteran Care Wing to identify and compromise active Special Forces operators. The thoracotomy was necessary because losing him meant losing the entire chain of command authorization for the intelligence handoff scheduled to happen in 72 hours. I'm not a reckless nurse playing surgeon. I'm a captain in the United States Army Special Forces, and I just saved the general's life because that was my mission, and I complete my missions. She couldn't say any of that. Because the moment those words left her mouth, the entire operation evaporated. 7 other operators whose identities were still classified would be exposed. The intelligence network that had taken 14 months to cultivate would collapse. The foreign operatives who were planning to hand over a complete roster of active Special Forces personnel, thinking they were extracting it from a compromised officer, would scatter into the wind. So she had accepted the termination in silence. Had handed over her badge. Had walked out of St. Michael's at 18:47 hours wearing civilian clothes and carrying 8 months of lies in a cardboard box. Rain drummed on the bus shelter roof with the rhythm of helicopter rotors. She could still feel the general's heart stuttering back to life under her palms. Muscle memory. Hands that had held that same rhythm in Ramadi, in a field hospital made from a shipping container and prayers, in the 14 seconds it took to stabilize a casualty before the medevac landed. Her hands remembered everything. Her hands never forgot. The bus was late. Of course it was. The rain had backed up traffic on Victory Drive. She stood there with the cardboard box getting heavier, watching the rain fall in sheets, and she didn't let herself think about what happened next. Didn't let herself think about the mission parameters she was violating by standing here instead of returning to active duty. Didn't let herself think about whether the intelligence handoff would still happen, whether the operatives would show up, whether everything the past 14 months had been designed to accomplish would just evaporate like rain on hot asphalt. The bus arrived at 19:23 hours. She got on. She didn't look back at St. Michael's receding behind her in the rain-soaked evening. She had no idea that 72 hours from now, the hospital's routine security clearance audit would flag her personnel file. She had no idea that the classification markers buried in her records would trigger an automatic DOD notification. She had no idea that Pentagon investigators were already being briefed, that a 4-star general with a fresh thoracotomy wound was already planning to return to that hospital, that Dr. Mercer's triumph would last exactly 3 days before everything he'd built came crashing down with the weight of federal authority and the presence of men and women who didn't answer to hospital boards. The rain continued falling. The bus pulled away from the curb. Margaret Walsh sat by the window, holding a cardboard box, staring at the reflection of her own face superimposed over the dark street, and waited for the next chapter of her life to begin. The bus pulled away from the curb. Margaret Walsh sat by the window, holding a cardboard box, staring at the reflection of her own face superimposed over the dark street. 3 days had passed since the termination hearing. 3 days of silence. 3 days of waiting. The box contained everything from her locker at St. Michael's. A World's Okayest Nurse mug with brown-edged lettering. A succulent with crispy leaves. A photograph of Corporal Davidson, grinning in Ramadi dust, rifle slung across his back. And underneath it all, wrapped in 2 layers of surgical tape, Corporal Davidson's flag. Folded in the precise triangular way they folded them. The way she'd carried it for 8 years. She didn't know the hospital's routine security clearance audit had already begun. The audit was supposed to be standard procedure, a quarterly refresh of background checks for all personnel with access to classified veteran care protocols. But when the software ran against Margaret Walsh's file, something unusual triggered. A buried marker. An encryption signature that didn't belong in a civilian nursing record. The kind of digital fingerprint that meant federal interest. The kind of thing that required immediate notification to the Department of Defense. By 6:16 a.m., 2 investigators with Pentagon credentials had cleared security at St. Michael's main entrance. Their shoes echoed differently than ordinary visitors. Shoes that had walked through checkpoints in Kandahar. Shoes that didn't hesitate. At 7:15 a.m., Hospital Administrator Carolyn Prescott was notified that a classified matter required her immediate presence in the board conference room. At 7:34 a.m., the general's bed was rolled quietly into that same room, not by orderlies, but by 2 men in dark suits who moved with the terrifying fluid precision of operators who'd seen actual combat. The monitor stood beside him, displaying a sinus rhythm steady as a metronome. The man inside that hospital gown should have been terminated along with Margaret. Instead, he was the reason she was about to be saved. Dr. Mercer arrived at 7:06 a.m., summoned by the hospital board to discuss the termination paperwork. He walked into that conference room still rehearsing his justifications. She violated scope of practice. She performed an unauthorized procedure. She's a liability and a danger. What he found instead was the board sitting in rigid silence. 2 federal investigators standing with the bearing of combat commanders. And the 4-star general propped up on his elbows, watching him with eyes the color of a military tribunal. For 18 seconds, nobody moved. Then the general's voice cut through the room like a rifle round finding its target. Not loud. Just precise. Reaper 6. Margaret's chest tightened. That call sign belonged to another lifetime. A lifetime that was supposed to stay buried under scrubs and night shifts and the pretense of being ordinary. The general's eyes fixed on hers. "Welcome home, Captain." One of the investigators stepped forward, a Marine colonel with a bronze star on his dress uniform and the bearing of a man who'd read citations at more memorials than he could count. He opened a folder with hands that had saluted presidents. What came out next was the official record. The one that had been sealed in a classified file for 8 years. Captain Margaret Walsh, 160th SAW Medical Squadron, attached to JSOC Task Force 121, the colonel read. His voice carried the weight of ceremony. Silver Star for courage under fire. Citation reads, for extraordinary heroism in connection with military operations against an enemy of the United States in the Republic of Iraq on the 23rd of March, 2014. Captain Walsh, serving as combat medic, extracted for severely wounded operators from a burning MRAP vehicle under sustained hostile fire, despite third-degree burns to both forearms. She carried operators at distances exceeding 100 meters while enemy contact continued. The room didn't breathe. The colonel turned the page. Bronze Star with Valor. For heroism in military operations against an enemy of the United States. Captain Walsh established and defended a forward field hospital in Sanjan Valley, Helmand Province, for 11 consecutive hours against coordinated Taliban assault. She treated 17 wounded personnel while sustaining incoming rounds, fracture of left radius, and severe blood loss. Her actions prevented loss of life among Allied forces. Dr. Mercer's face had gone the color of hospital linoleum. An aide, a woman in a Navy uniform, stepped behind Margaret with the practiced gentleness of someone who'd helped soldiers dress for formal occasions. She unfastened the cardigan Margaret had worn for 14 months. The cardigan she'd chosen deliberately, long sleeves covering everything that would matter, everything that would identify her. As the aide slowly unbuttoned the shoulders, Margaret's sleeve tattoo became visible. All of it. The full memorial piece that covered her shoulder and upper arm like a coat of armor. There were names. 17 of them, rendered in precise lettering. Davidson. Chen. Castillo. Williams. Ortega. Martinez. Jackson. Torres. Robinson. Anderson. Garcia. The names of her unit, the ones who didn't rotate out. The ones who came home in flags. Beneath each name, the coordinates of where they fell, Ramadi grid references rendered in numbers only another operator would recognize. And at the center, the crest of the Special Forces Command, surrounded by a wreath of flames that rose from the burning MRAP on the day everything changed. The general's voice came again, softer this time. "Stand at attention, Captain." Mercer opened his mouth. This is fraud. She misrepresented herself. The general struggled upright. The effort of it should have triggered alarms. Should have brought nurses running. Instead, the investigators stepped slightly closer, blocking the path to the door. The general's hand rose. His body straightened. His salute came crisp and deliberate, the kind of salute that was reserved for officers who'd held other officers in their arms while they died. The salute held for 3 full seconds. Then the Pentagon investigator spoke. His voice had the clipped precision of someone reading a criminal indictment. "During our security review, Dr. Mercer, we examined the complete medical records for all personnel assigned to this unit. Your complaint against Captain Walsh triggered a comprehensive audit of your own file." Mercer's eyes widened. 18 months of falsified records, Doctor. 11 documented instances of altering patient outcomes to conceal surgical complications. Mrs. Helena Ostroff, age 73, internal hemorrhage from a hepatic artery laceration that you elected not to report for 6 hours. Mr. Robert Chen, 56, post-operative sepsis that originated from contaminated surgical technique you documented as patient non-compliance. Denise Morris, 61, inadequate hemostasis leading to delayed cardiac arrest after a routine bypass repair. The investigator swiped a tablet. Documents displayed on the screen. Mercer's own handwriting. Corrections. Crossouts. Dates and times that didn't match the operative notes. 3 patients dead due to preventable causes. The State Medical Board has been notified. The Federal Bureau of Investigation has been notified. Your hospital privileges are revoked as of this moment. Criminal charges are pending review by the U.S. Attorney's Office for the Eastern District of Georgia. Mercer's voice rose. Desperate. Grasping. She's the problem. She's been undermining me from the beginning. Scar tissue. That's what, she's the one who. You used the same meticulous documentation you weaponized against Captain Walsh to hide your malpractice, the investigator said. His voice could have frozen blood. Federal investigators are considerably more thorough than hospital administrators, Doctor. Security entered. 2 officers in hospital security uniforms, but the authority they carried came from a much higher pay grade. They escorted Mercer toward the door. His resistance was instinctive, desperate. "You can't do this to me. I'm board certified. I have partners. This is terminated," the investigator said. As of 7:52 a.m. Mercer turned back before they removed him from the room. His face was unraveling. "You destroyed me." Margaret's voice, when she spoke, was quiet. Steady. The voice of someone who'd performed battlefield triage at 3 in the morning with incoming rounds. "No, Doctor. You destroyed yourself. I was just doing my job." The door closed on Mercer's face. The sound of his protests faded down the corridor like a frequency going out of range. The general lowered his arm. His monitor beeped its steady rhythm. His eyes never left Margaret's. "Your mission is complete, Captain. 14 months. The foreign intelligence operation targeting the Veteran Care Wing has been neutralized. 3 operatives are in federal custody. 17 active Special Forces personnel were protected because you held your cover. Because you were invisible when it mattered. 6 months later, Margaret Walsh would complete her final debriefing at JSOC headquarters in Fort Bragg. The intelligence she'd gathered would prevent 7 attacks on military personnel. The operative she'd identified would face charges in federal court. The unit she'd protected would return to theater with actionable counterintelligence. She would receive a promotion to major and a new assignment training combat medics in field surgical procedures. And she would understand, finally, that the burned scars on her forearms, the ones Dr. Mercer saw as weakness, were not a liability. They were her credential. They were her proof. They were the reason she'd been chosen for a mission that required someone who knew what it meant to pull people from fire. At St. Michael's Hospital, the board would establish the Davidson Memorial Fellowship for military nurses transitioning to civilian healthcare, funded by a generous Dodd grant and her own quarterly donations. Dr. Mercer would teach CPR certification courses at Savannah Community College for $18 an hour, his medical license permanently revoked in 4 states, his name a cautionary tale whispered in malpractice seminars. At night, alone, he would stare at his ceiling and understand that he'd spent his entire career trying to diminish people, never realizing that the quietest person in the room might be the one holding it all together. In her quarters at Fort Bragg, Captain Margaret Walsh would unfold Corporal Davidson's flag with careful reverence, running her fingers over the tight triangular folds. The photo would show him grinning in ramady dust, rifle slung across his back, alive. She would trace the names on her tattoo sleeve with her finger, feeling each coordinate like a prayer. She would refold the flag precisely, set it back in its case. And in the lamplight, her burned scars would tell the story that no credential ever could, the story of someone who walked into fire because someone had to, because the people she loved were on the other side, because that's what it meant to serve. Some scars tell stories that shame can never touch. Thank you for being here. If you're enjoying this story, please like and subscribe. And we always love hearing from you. Drop a comment and tell us what state or country you're in.